Good afternoon, ma'am. Good afternoon, everyone. Am I audible, ma'am?
Yes, please begin.
Hello, am I audible? Okay. A very good afternoon to myself, Manish Trivedi, faculty of Parul Institute of Nursing, Parul University. As you all know, we are here to discuss about issues related to nursing practice. As the nurses dedicated their lives to caring for others, their own professional and personal needs may fall by a wayside. That's why organizations like the ANA and dozens of others membership support and advocate for the more than 4 million US nurses. As a part of that work, the ANA has zeroed in one of the some challenges nurses may face today in their nursing career. Here are their top issues for the nurses are: one is inadequate staffing. So being short staffed for the brief period of the time is common in most professions and in many of those situations. It is the more inconvenience, but in nursing, inadequate staffing can be a matter of life and death. Next is like mandatory overtime. Working long hours due to inadequate staffing, job turnover, and other factors can result in chronic overtime, placing another burden on nurses. Next is like stay on the job. Many factors must come together to create a work environment, to safe work environment. ANA initiates to improve the workplace safety, which can include the safe patient handling and the safe needles. Next is like workplace violence. So healthcare and social services works, workers face an increased risk of work-related assaults resulting in primarily from violent behavior of their patients, clients, and or the other residents. Next is improving self-care. This didn't make the ANS tightly focused list, but it is an issue inextricably linked with the nursing profession. Care for yourself so you can care for others. An age-old disease that is easily forgotten in our jam-packed personal and professional lives. As a caregivers, nurses have been socialized to care for others and thus often prioritize to needs as second. To enlighten us regarding the subject, we are delighted by having the opportunity to invite Professor Mrs. Lolita D'Souza as our honorable speaker in our webinar. Ma'am has completed her post-basic BS Nursing from the Father Mullah College of Nursing. Ma'am is having a master degree in obstetrics and gynecological nursing from SCS College of Nursing Science, Mangalore. She is the principal of SCS College of Nursing, Mangalore. Madam has enough experience in teaching and has published many scientific papers in Index Nursing and Medical Journal. She has reviewed many nursing books and written a chapter of microbiology and many more books. Madam has acted as a resource person for many conferences. And now, without much delay, I request Madam to start the session. Thank you.
Thank you, Manish. Can I start?
Thank. Yes, ma'am. Yes, ma'am. Please.
Yeah, I'm audible.
Yes, ma'am. You are audible.
Yes, okay. Yeah, a very good morning to everyone. Hello.
Good morning, ma'am.
Yes,
Good
good
morning.
morning to everyone. First and foremost, I would like to thank the management and the principal of Parul Institute of Nursing, and as well as Mr. Manish, the coordinator, and Mrs. Vinaya for having coordinated this webinar right from the beginning. So I take this opportunity to thank each and everyone and for giving me a chance to speak on this topic, that is issues related to nursing practice. So most of the audience is the student group, I believe. Is it Manish?
Yes, ma'am. Yes, ma'am.
Yes, the student. Okay, fine. Yes. The issues related to nursing practice, as you can see in the picture, it conveys something, some message is there. I don't know how far you're able to get in the entire message, but definitely it conveys something to you where you see a staff nurse and surrounded by too many things. Besides, might be difficult to handle. That is what it conveys. Is to begin with the topic. As we all know, nurses play a vital role in the healthcare system. And it is not just limited to taking care of patients, but also the nurse takes up leadership roles in the hospital, in the organization, wherever she or he works, and even in the healthcare system. And we know, although nursing is a rewarding profession, but at the same time, it's challenging too because it has to have certain level of dedication and commitment. And on the other side, we see, despite urbanization and globalization in India, the healthcare system has undergone tremendous change. And with this, we see people around. They expect skillful nurses to take care of them, nurses who are motivated and supportive. And when such is a scenario, it is definitely challenging for the nurses to take up this role and to face so many things that come in their way. So, what is important for us today is to recognize all these challenges, however they are, and we need to understand each of these challenges and how to overcome them, how to face them while working in the healthcare system. And not only this, in the healthcare system, we see there is increasingly detached, it is increasingly detached from the curative aspect of care. And we see many a time some of the hospitals, they are more into the material needs and the profit based aspect. So, on one side, we have this as a scenario, and the nurse has to definitely balance when she or he works in such a system. And this is what we are going to know today. What are those challenges that the nurse has to face? And before we move into those challenges, let's see what is nursing practice. Nursing practice is defined as a diagnosis and treatment of human responses to actual and potential health problems. Yes, we know as nurses, when we approach our patients, first is we need to identify what are their needs and what are their health problems, and we need to prioritize them like the primary or the secondary. That's how we prepare the nursing care plan, the nursing diagnosis, the short-term goals, the long-term goals. This is how we go about with all this, and this is based on this we diagnose and treat the patient. Now, let us move into the challenges that are faced by nurses in the field of nursing practice. Am I audible? Manish, am I audible to you? Manish, am I audible?
Yes, ma'am, you're
Yes,
audible.
yes, yes. The issues now, there are various issues. So let us see one by one. First is the inadequate staffing pattern. So, we like the inadequate staffing pattern means there are no adequate staff to take care of the patients in a unit. Now, this not only poses a threat to the patient's health and safety, but the staff nurses also are at risk because the moment there are inadequate nurses, we have few hands in the unit. It puts a lots of pressure on the staff, and also it results in fatigue. So, such a scenario, how the nurses are going about with limited hands. Definitely, if there are extra hands, extra staff nurses, we can provide quality care to the patients. But with limited hands, it's definitely difficult. And we have seen just before the pandemic, 5% of the hospital nurses left their positions. And this was also an important implication for the hospital administrators. And even when the hospital surveys was taken, it reported that 56% of the staff nurses had left the job. So definitely this has contributed to inadequate staffing. On the other hand, we see some hospitals, they do not want to recruit the newly graduated nurses because they feel that they are not experienced. On the other hand, we see some of the hospitals, they do not want to keep experienced staff because they have to invest a lot on them. So sometimes the successful corporations also, they invest only up to 20% of the revenue back into their employees. And that is why some of the hospitals, they just rely on just in time staffing. So whenever they require the staff, they keep them on contract basis. And this has definitely resulted imbalance in the nurse patient ratio. And when imbalance is there, we can see the drawbacks coming with it. Like patients, patients can die because of like the staff is not able to reach out them on time because limited staff, and patients having infections, injuries, and sometimes there is no adequate time to explain to the patients on discharge regarding the follow-up. So this has resulted in morbidity on follow-up. So if there was enough time or enough staff nurses were there, the patients can be explained very well regarding the discharge and follow-up. Thereby, we can reduce the complications in the patients. And the WHO also has reported there are 28 million nurses worldwide, but still 6 million more nurse jobs are to be filled by 2030 in order to meet the healthcare requirements. So this is one issue, one challenge. Next, the second thing is mandatory overtime. So, with overtime, it happens because there can be inadequate staff. So the existing staff have to make up and stay back for longer duration in the unit to take care of the patients and complete the procedures. And this can definitely pose a burden on them and also result in burnout, medication errors, and so on. And also leaves exhaustion for the state of mind and body of the staff. So overtime also another challenge. And next is the workplace violence. So workplace violence, we all know what happens. Nowadays, we get to see or hear in the media. Nurses often are increased risk of violence they get to face from the patients many a times, and the clients as well as the residents. And what is the type of violence that they face? It can be in the form of threats, verbal abuse, mental abuse, hostility, harassment, and this leaves psychological trauma and stress on the staff nurses. And sometimes it can also end up in physical abuse or physical violence. So this is another issue that is happening, and that is the reason the Occupational Safety and Health Administration has come out with guidelines for preventing workplace violence for healthcare and social workers. So that is how now some places, to certain extent, this is limited or prevented, the workplace violence. Next, we see safety on the job. Yes. Now, what was about the safety? Staff nurses always are at risk, either from biological, physical, or chemical hazards that happen while taking care of the patients. Biological hazards can be in the form of transmission of communicable diseases, the virus, as recently the COVID-19 has brought about. And the physical hazard can be sometimes the back injuries while lifting the patients. And then the chemical hazards from the anti-neoplastic drugs. Even needle stick injury is a right example. Bloodborne infections. So these also are the issues that we get to see. Next is meeting patient expectations. Yes. Nowadays, most of the people, they have ownership over their health. So, example, now if a person is found to be having some symptoms, before going to the hospital, definitely he will just log into the World Wide Web because it is available at the fingertips of each and every person nowadays. So it's easy to access, log in, and check and see what is wrong with the person. They just type the symptoms and see it is related to what condition or what disease. So they are well knowledgeable even before coming to the hospital. So when they get into the hospitals, when they are admitted, they have some amount of knowledge. So they question the staff nurses at times regarding their symptoms, and also they have high expectations about the care. So in such a situation, the value-based care has to be provided, where the staff nurses have to see that they are providing quality care, looking into the safety of the patients. That is what the patient expects. And like nowadays, many patients, they just keep on calling the staff nurses every now and then to provide care wherever is required. So the staff nurses are expected to be there at any time. So sometimes they even have to forgo their lunch timing or rest periods, so on. Sixth, organizational changes. Yes, even this is a challenging issue. Some organizations, they are poorly structured and they don't have proper guidelines. And this has happened sometimes even during COVID, where some of the firms, the hospital setup, the organizations, they change hands. They hand over to some other management, and then when the change hands, the policies get changed, the protocols change. So the staff who's working there has to adapt to all this immediately. So this is another challenge. Now, if the organization is having a firm ground, definitely they provide support to their employees. But sometimes there can be crisis in the management that can affect the working system of the staff nurses. Are you able to follow? Am I too fast?
Yes, ma'am. No, no.
Yes, okay.
It's not.
Next, we see improving self-care. Yes, as caregivers, many a times we nurses, our first priority is the patient. And the secondary aspect is about ourselves. So we forget to take care of ourselves. This happens many a times and it results in burnout. Nurses are trained caregivers and they forget themselves at times about their health, their physical, mental, and spiritual health. Always at the forefront, doing things and working for the safety of the patients. And very well, we have seen this during the pandemic, where most of the staff or the medical fraternity had to leave their homes and stay in quarantine or isolation, or stay back in the hospital, so that the family members don't come in contact with them, because the containment zone was there, and so on. So what happens here, they forgot to take care about themselves, and this has resulted in emotional and mental outbursts among the staff and the other medical fraternity also. So why not give some time to ourselves? That is very much important. It's only then we can take care of others. So give some time for some physical activity, some relaxation techniques, or even to go for a walk, read a book, go out with friends. So involve ourselves in some of these techniques like meditation, yoga. So this will definitely bring about positive health in us. Next is eighth, need to be technologically savvy. Yes, healthcare technologies have entered the market, and we see daily there are lots of changes. What was prevailing today, the system, it is not there for tomorrow. So something new comes there. And this has been introduced while giving patient care to document whatever is being done for the patients. We see the laptop carts and the intuitive workstations on wheels in the hospitals being introduced. Now, what are these workstations? In the workstation, we have a laptop or a computer that is fixed, and it also has the medications, emergency drugs, as well as other equipments for checking the vitals of the patient. So it is all equipped in this workstation. on wheels. So it can be taken from one patient to another. So the nurses need to be knowledgeable and equipped with all this to know how it works. So this also is another challenge for the nurses. Ninth, increase specialization and career path options. Yes. So now it is said that currently there are nearly 96 areas of specializations, and specializations we can say because the area is broad now. So it's just not limited to the hospital area where the nurses have to just take care in their particular unit, but they also can update their knowledge, going for specializations, and that's how they can end up working in multi-speciality hospitals which are accredited, and taking up specializations such as pediatric, cardiac, ortho, anesthetist, nurse anesthetist, and so on. So many specializations are there, and research is also is one of the important aspects. So we need to move along with this technological advancements. So the curriculum also needs to be changed in the educational sector. So that is very important. So before we used to focus on hygiene, diet, and comfort measures, but present need is focused on specialization and advanced knowledge. That is most important now. So even this is a challenging task for the staff. Next, the rise of telemedicine. Yes, we see in the year 2020, there was a shift in how the Americans interacted with healthcare during COVID-19. And it is also said that there are reports that telemedicine revenue is projected to be triple by 2023. And the patients or any clients who want to seek advice on health, they can virtually contact the doctor. They can check in the area of specialization and discuss these matters virtually. So it is found to be more flexible, and this is another challenging task where nurses also have come forward and are conducting virtual sessions in the field of telemedicine. And there's a chat box where the clients can clear their doubts or the queries, take appointment with the doctors, set reminders to take their medication, and so on. So this telemedicine also is an important aspect. And during COVID-19, we see where the patients are not able to come and see the doctor. Telemedicine has gained an important role during this time. Next is lack of synchronicity. Yes, that means there is disharmony and lack of teamwork among the healthcare members. Definitely, we want to achieve quality care. We should work harmoniously with all the members of the health team. That is of utmost importance, because while working together in a unit, we come in contact with the other healthcare workers. If there is continuity of care for the patients, it all depends how well we have communicated and coordinated with the members of our health team. So only if there is teamwork, definitely we can achieve positive results at the end, and we can see to the safety of our patients. And sometimes we get to see in some of the hospitals where the equipment is not working or it's not available. Sometimes, even though the nurses are not accountable for it, they are being blamed for. And finally, they are being targeted. So this issue we get to see many a times where the differences are there. And most of the time, the nurses are questioned upon for all these things where they are not directly connected. So unnecessarily, they have been questioned by the authorities. So this is the lack of synchronicity that we get to see in the medical field. Next is lack of recognition. Yes, anyone who contributes for the work, they expect recognition when they have done something. Yes, recognition in the form of rewards or promotion, incentives, or praise, and some felicitations done on the some occasions that is observed in the organizations or in the hospital. Yes, they feel happy when the staff is recognized for the work they have contributed. It sends a positive message to them. It's rewarding to them, and definitely they can contribute much more better in the next phase. But this recognition aspect is missing many a times in some of the institutions. And even during COVID 19, we have seen how the staff nurses were in the forefront for each and everything, forgetting about themselves. And some of the institutions definitely have recognized them by giving them the rewards. Yes, this is something nice to know. But some places they have been denied. It has gone unrecognized, whatever the services were put in. So recognition also is an important part. We get to see during inspections in the hospital how the staff nurses update the records and see that everything is done perfectly. But then after the inspections, there is no recognition that is given to them for whatever work they have contributed. Next is the non-nursing roles. Yes. So I think as where majority are students in this group, you must have seen during your clinical experience the exposure that you have, how the nurses end up doing the non-nursing roles other than what they're supposed to do. They don't, because they are forced to do sometimes, and such as like billing, record keeping, inventory checking, laundry, diet, physiotherapy, or absconding of patient. So all those things they have to face. So they have to take up responsibilities for all these non-nursing roles as well. So finally, there is little time left for them to give quality patient care. So when such is the thing, it is difficult. So that is why the job description is very important here to outline and say what is expected from the nurses. Next is brain drain. So this is another worry now currently in India, where most of the staff nurses, they leave the country and go in search for better job prospects, remuneration, better working conditions, and better respect. So we have seen, because they are not able to like economically, they are deprived of certain things. They are not able to look after their families. So it is a pathetic situation here. Some of the hospitals, they don't give the proper dues to the nurses. So that is why they're forced to leave their jobs here and seek job in other countries to have a better future. So that is why we have acute shortage of experienced staff. That is really a very sad thing to know. Experienced staff, when they leave the country, we are at loss. So brain drain is another disturbing thing that is the issue that is taking place. Next is improper incentives and pay scales. Yes, pay scale is still lower compared to other professions in most of the institutions or the hospitals. Incentives are not given for transportation, or good housing can be given. So they are deprived of all these incentives, and that is why this is another issue. And apart from there, this we also see another issue, that is control of practice. There is no autonomy most of the time for the nurses to exercise what can be done. So they are being controlled by someone. So these are some of the issues that we get to see in the nursing practice. Yes, let us see to some facts and figures. By 2030, the world needs 18 million more healthcare workers to meet the requirements of universal health coverage. 6 million of the healthcare workers needed by 2030 are nurses and midwives. Globally, 70% of healthcare and social workers are women. So these are certain facts that we have placed before you. So from this itself, we will know what is the requirement for the staff nurses, and globally, what is the shortage and how to overcome this. So this is another challenge. And the biggest challenge is the COVID-19. So I put a little note on this too, along with the issues, because this was the thing that was prevailing for the past 2 years. We are getting to see the biggest challenge. With emerging mutations, slow vaccine rollout, and there is still plenty of illness, suffering, and death in globally. And definitely, nurses must be prepared at any time to face this. Already, we know how nurses have slogged during COVID-19 when it was at its peak, and definitely they have done all their best whatever they could, and many have lost their lives too. So here the biggest challenge, the compassion. Yes, we do have compassion, and we are continuing with it. That is the very reason we see nurses in the forefront. The fatigue is involved, taking care of the patient, that is with PPE kits. It's not that easy. There is emotional trauma, and there is fear of contracting COVID too while taking care. There is exhaustion and overworking. Can see in the picture how with the PP kit it is so uncomfortable, and the supportive network, underpayment in spite of contributing during COVID-19. Some staff have not yet received their dues, so there is underpayment, or they were not given incentives too. And there is staffing issues. Some have left the job because it was a burden for them. So this is another challenge before us anytime to get prepared, because the pandemic is not yet completely over, and we need to be prepared for this. So the data from surveys collected in March 2021 shows that burnout and stress were prevalent among half of respondents. 21% of those surveyed reported going to work angry. In practice environments, PPE was in short supply, and 48% uh, reported that they were considering leaving the job altogether. So this is the outcome that is there after the following the pandemic. So this is another challenge for us. Now, how are we going to go about in finding the solutions to curb the challenges? Yes. The positive practice work environment. Yes. That is the ability to provide quality care. The work environment that we are in have to see to our safety as well as the safety of the patients too. See, the nurses definitely should be given the dignity and the autonomy, and they should be empowered to come out with all their work and be satisfying too at the same time. They should be given respect and have harmonious relationship with one another. It's only then they can work with motivation and encourage to do better. So positive practice, the wages, that is salary or the incentives, whatever is lacking need to be improved upon. It's only then it will add to the positive practice work environment. Next is the equipment and materials. Yes, there should be adequate supply of materials. It's only then we can provide quality care. Yes, again, at times we see this, there'll be unavailability, the equipments are crippled, they don't function, especially the oxygen apparatus or the autoclaves, the IV drugs, that is emergency drugs are not available. So if there is availability of all these equipments, and the hospital management has to look into all this, and it will favor to smooth functioning in the hospitals. Next is the positive teamwork. Yes, there should be a positive teamwork. All the members of the the health team have to get together and have a positive opinion, because finally it reflects on the patient care that is being provided. So teamwork is very important. Set aside the differences that they have and work together. Next is recruitment or retention policy. Yes, the organization should have set guidelines and even for recruitment and for retention also of the employees. If they are found to be good, experienced, they can definitely retain their manpower and help in the betterment of the organization. Next is closing education and service gap. Yes, we can see that this still there is a difference between the things that are being taught in the to the nurses during the study period, and when it comes to the actual hospital practice, it differs. At times, we get to see this. So there should be policies where practical and theoretical things have to be coordinated, and there should not be any gap, and there should be coordination between both this sector, that is the education and the practical side. It's only then, because and moreover the students also need to be taught the reverence for human life, the respect for human life. It's only then we can go about being safety to the patients. Next is the workload balance, both in quality and quantity. For this, we need to have adequate staff, proper organization, and division of workload in the unit. So it should not pose a burden to the staff nurses because it results in burnout. So if it is planned, definitely we can bring about the workload balance. Next is the evidence-based practice. Yes, this is also gaining importance. We have seen where the research activities are being conducted, experimental studies are done, and they are found to be benefiting the patients in providing quality care. Definitely, such practices can be implemented. So we can overcome so many issues with this, and also improve the knowledge of nurses in providing better health care to the patients. So these are some of the solutions where we can face those challenges, because we cannot just sit with these problems, but we need to uh, critically analyze where the problem is, whether it is at the organizational level, whether it is among the team members working in a unit, or it is some other source. So need to find out where is the problem line and how to find solutions to this problem solving methods. Okay, so needs to be applied, and how we can solve these problems, we need to think on it, and definitely we can have better patient care. So to conclude, um, catering to the needs of nurses and combating their challenges can make nurses empowered, encouraged, challenged, and affirmed to continue doing what they do best without any barriers. Yes, we need to empower our nurses. It's only then when they are encouraged, they can face all these challenges. So today we have discussed regarding the various issues that we are coming across in the health sector, that is in the nursing practice, regarding the inadequate staffing pattern, the overtime that is prevailing, and the safety concerns in the unit when we are working with our team members or with taking care of our patients, the violence that is met at the workplace, the expectations that the patients have, because nowadays everyone is knowledgeable to certain extent. Even they have, because the patients, what they do, if they just see to their the access and check and see what are the various exercises, or what type of diet they can take, or the immune boosting habits or the physical fitness that can be implemented. So they log in and check on all these areas. So they have expectations too. So how are we going to meet this? The organization changes that are taking place. So how we will fit into such organization? So that is a challenge. And the technology that is being introduced, that and even it's been changing day by day. How are we going to meet this challenge? the recognition aspect, and the non-nursing roles that have to be taken. So how are we going to shift from these roles? So that has to be conveyed to the higher authorities in the management, saying that to ask for proper job descriptions and see to what are our roles and responsibilities, make it clear during the time of recruitment. That's how we can avoid all these issues later on when the staff is at work. And the brain drain challenge. Yes. So the major challenge also we have discussed regarding COVID-19, how the nurses have slogged and were in the forefront. And this posed a biggest challenge where most of them were not prepared at all to face this. And whatever came in their way, they had to do it. Like it was like at the moment to decide and do. So this there was no enough training. There was no time also to get trained for all this. So that was the challenge in the first time when the pandemic came. But most of them have successfully gone ahead and shown and done their best and have overcome these challenges. And we have seen how what are the solutions, that is providing positive work environment and providing proper materials, having a good teamwork, having a proper recruitment policy, or how to bridge the gap between education and practice, and also the evidence based practice, which has to be given more importance. So these are the various ways where we can like solutions, we can overcome these challenges, that is the issues.
Okay, thank you, ma'am.
Yes, Manish, yes.
Okay, yes. If any participants have any doubt, then the session is open for the question. Any
Yes.
participant? I think there is no any doubt from the participant side.
Is it
Uh,
okay?
Thank you, ma'am. On the behalf of Parul Institute of Nursing, Parul University, I extend my heartfelt thank you for enlightening us with your immense knowledge, ma'am. Thank you so much.
Yeah, thank you, Manish.
Thank
And
you.
once again, I thank the organizers too.
Thank you.